Provost and Deputy Vice-Chancellor, as public orator, may I, Nigel Cesarge, present John MacDonald, a candidate for an honorary degree. John MacDonald remembers that one of his first boyhood ambitions was to be a dustbin man. That is certainly an essential calling, but it seems an unlikely prelude to his subsequent distinguished career managing the even more vital resources of the National Health Service. Although educated largely in the UK, John was born and spent much of his childhood in Malawi. This background was undoubtedly a factor in his early career. He was educated at boarding school in England and then studied economics at Bristol University, where a fortunately timed careers discussion with his professor led to a fellowship from the Overseas Development Institute. John then spent 2 years in Botswana working on World Bank UN projects, tackling issues of overgrazing, wildlife, drought, and refugees. And this led in turn to an MSc at Oregon State University on agricultural economics. As John says, Africa never leaves you. So this was a springboard to 4 years as an economist, and financial consultant to the World Bank, the UN, the UK government, and others in developing countries like Malawi, Pakistan, and Sudan, where John cryptically describes sharing a government rest house with 30 Sudanese soldiers as eventful. John found the work personally rewarding, but it involved spending much of the year abroad with no real home base. A turning point came when he joined Touche Ross, who had advertised for people to work both overseas and in the UK. This offered more stability, but the international portfolio turned out to be rather thin. So John was given projects developing business cases for prospective NHS trusts. And while working with Brighton Health Authority, John was influenced by the values of the District General Manager, David Bowden, and his commitment to securing better outcomes for patients. And so began John's 13-year executive career in the NHS, including posts as Chief Executive of Derbyshire Royal Infirmary, the Oxford Radcliffe Hospitals, and the Queen's Medical Centre, Nottingham. At Oxford, the Vice-Chancellor remarked on John's ability to strengthen the relationship between the Trust and the university, an invaluable attribute from which we at Leicester have greatly benefited since. This period of substantial success in very demanding positions was interrupted by ill health, and it was a considerable personal achievement on John's part to rebuild his career in the NHS, culminating in 15 years on what John describes as the dark side, that is, non-executive NHS positions at the highest level. John was appointed the independent chair of several Midlands organisations established to enable the NHS, local authorities, voluntary sector and others to work better together. And he chaired some of the largest and most complex NHS trusts in the region: University Hospital of North Midlands, Sherwood Forest Hospitals, University Hospitals of Leicester, and University Hospitals of Northamptonshire. These were certainly not sinecures, nor is John the sort of leader who merely presides over the achievements of others. During his chairmanship, Sherwood Forest Hospitals became NHS Trust of the Year, having previously been regarded nationally as failing, with concerns about mortality rates and other quality and financial difficulties. And when he joined the board at Leicester in 2021, there had also been financial issues. He strengthened both the board and the management and improved quality and access, with impressive improvements in planned care. His experience of working in deprived areas overseas was reflected in the introduction of an executive director for health equality and inclusion, a first for the NHS, putting patients from disadvantaged and minority ethnic backgrounds at the heart of clinical decision-making. Comparable strides were subsequently made in Northamptonshire, where the two separate and poorly coordinated trusts have been brought together under a single board and executive team. Turning round a floundering NHS trust calls for many more skills than the proverbial turning of an oil tanker. John has brought his long experience to identifying strategic, structural and operational weaknesses, combined with a deep knowledge of the NHS. But there is an additional ingredient: his humanity. If you ask him to name someone he has admired, he would say Steve Biko, the anti-apartheid activist killed by South African police, for his courage, commitment, and vision of a better world. Ask him about his greatest professional challenges, and he refers to apologizing to the parents of a patient shortly before their life support system was switched off. It has been observed that John has a rare combination of getting difficult things done while always supporting people, and this has driven his success in so many different organizations. He generates followership because he so clearly cares about people, whether they are his board, the wider colleagues across his organizations, or the patients they serve. John MacDonald has now retired after 35 years of exemplary service to the NHS. He has earned an active retirement with his wife Karen, rewilding their 6 acres in the Peak District, attempting to keep bees, and travelling in their camper van. Managers of major public services do not always enjoy a good press, but John is different. As we celebrate the 50th anniversary of the Leicester Medical School, it is particularly appropriate that we can give full public recognition to the outstanding contribution John MacDonald has made to improving healthcare throughout our region and as a model for leadership throughout the NHS and indeed beyond. Provost and Deputy Vice-Chancellor, on the recommendation of the Senate and the Council, I present John MacDonald that you may confer on him the honorary degree of Doctor of Science.
Provost and Deputy Vice-Chancellor, dignitaries, graduates and guests, I'm very honoured to be part of this ceremony and to be receiving an honorary doctorate from the University of Leicester. And thank you, Orator, for your kind words. While I've received this for doing my job, those of you who are also getting your certificates and honours have done it through several years of studying and hard work. So thank you for sharing your day with me, and congratulations to you all. I'm particularly honoured to receive this award for 2 reasons. First, it follows from the recommendations made by people I have worked with. It's great to see a number of them here, and can I also thank them, because it's on backs such as yours that have brought me to where I am. So thank you very much for your hard work and support. Secondly, I've been lucky enough to have worked in several health academic partnerships with the universities of Oxford, Keele and Leicester. But Leicester is very special, and the partnership between the NHS in Leicester and the University Hospitals of Leicester is one of the best. To be a strong academic health partnership, I think you need 3 things. You need to have a leading university. You need to have a strong, innovative health service serving at least 2 to 3 million people. And above all, you need people who want to work together and who recognise the benefits of doing so. Leicester has all 3 in spades. In 2022, I was lying on a beach on the Isle of Mull, and I opened the paper to see the headline, "Leicester beats Oxford in the clinical medical research rankings." If you go onto ChatGPT, verified I should hasten to add after the events of the last few days, you see a list of the most internationally and nationally renowned organisations providing funding for clinical research. That, I think, speaks to the quality of the medical school and its work. I believe that the partnership between the NHS and the University of Leicester has been an important factor in securing that funding, and I hope that it continues to be so. Education and training are critical aspects of our partnership and mean that the people beyond Leicestershire and Northamptonshire benefit from highly trained people to provide their healthcare. I don't just mean doctors, nurses, therapists, and other clinical staff. There are over 27,000 people working across the universities of Leicester, Northampton, University Hospitals of Leicester, Northampton, and Kettering, with whom the University of Leicester now works increasingly. In primary mental care, social care, and other jobs, there are very few jobs that you can't find in the health service. And it was interesting, already today we've heard of people getting degrees and masters in health service management and aligned degrees. So finance, human resources, data analytics, construction, hospitality are a few. Even nuclear physicists are needed by the NHS. The list is endless. The University of Leicester is ranked very high, 5th, I believe, in the latest Times World University of rankings. And this is a fabulous pool of talent from which to recruit. Hopefully, some of those people who get degrees and awards today will be working in the NHS, if not immediately, then later down in their careers. But being a leading academic partnership doesn't just happen. It happens because of the fantastic people and the leadership people who work both at the universities and in the Leicester and Northamptonshire health services. As a past chair of the University Hospitals of Leicester, it has been an honour to work with so many people. I know that other people before me have received this award, people like Chris Whitty, who was the previous medical officer. He got one not so long ago. I think that shows the esteem in which people at a national level as well hold the university. And I know that the future of healthcare in Leicester is in good hands, and the partnership will continue to grow from strength to strength to improve healthcare for the people of Leicestershire, Northamptonshire and beyond. So thank you very much, Provost, for this award. Thank you.